There's a number your doctor almost certainly hasn't mentioned in the context of your hair. Not because it isn't important, not because the research doesn't exist, but because the connection between this particular deficiency and hair loss is one of those findings that takes years to travel from published research into routine clinical conversations. Here's the number. According to a 2023 study published in Frontiers in Nutrition that analyzed over 11,000 Americans between the ages of 50 and 79 using National Health and Nutrition Examination survey data, approximately 53% of middle-aged and older adults in the United States had vitamin D levels that were either insufficient or deficient, more than half. And in 2024, a systematic review and meta-analysis published in Frontiers in Nutrition, PMC1 Lol Serum 479915, that analyzed all available studies on vitamin D and hair loss found something that dermatology researchers have been quietly documenting for years. Over 47% of patients with male pattern hair loss, over 50% of women with female pattern hair loss, and over 53% of people with the most common form of diffuse shedding had vitamin D deficiency. These aren't fringe findings. They're peer-reviewed data from multiple published studies, pooled together, and analyzed systematically. And most people losing hair after 50 have never been told about them. Today we're covering exactly what the research shows about vitamin D and hair follicles. Not the surface-level claim that vitamin D is good for hair, but the actual mechanism, the actual numbers, and the honest limits of what supplementation can and cannot do. If you haven't subscribed yet, hit the bell. The next video covers the 3-nutrient protocol that studies have connected to gray hair, including one nutrient that over 60% of people in the graying group were found deficient in. Different topic, same principle. Deficiencies that most standard panels don't catch in time. But first, the biology. Because once you understand what vitamin D actually does inside a hair follicle, the connection to hair loss stops being surprising. Most people think of vitamin D as a bone vitamin, something you take to prevent fractures, something that comes from sunlight and milk. That's not wrong. But it dramatically undersells what vitamin D does in the body, and specifically what it does inside every single hair follicle on your scalp. Inside hair follicles, there are specialized protein structures called vitamin D receptors, or VDRs. These receptors don't just receive vitamin D, they actively regulate the hair cycle. Research published in Molecular Endocrinology by Scoria and colleagues, and further confirmed in a landmark 2007 study in the Proceedings of the National Academy of Sciences, demonstrated something fundamental. The vitamin D receptor, expressed in the keratinocytes of the hair follicle, is essential for the maintenance of normal adult hair cycling. In plain language, when VDR function is absent or compromised, hair follicles lose the ability to reinitiate the growth phase after shedding. The hair falls out and doesn't come back. This was so clearly established in the research that a 2010 review in the Journal of Investigative Dermatology, PubMed PMID 27-8699, concluded that the vitamin D receptor plays a critical role specifically in anagen initiation, the phase when new hair growth begins. Without proper VDR signaling in the follicle, the transition from the resting phase back into active growth is impaired. Here's the part that connects to what's happening in millions of people over 50. You don't need to have zero vitamin D for this system to be affected. Suboptimal levels, levels that fall within the technically normal reference range but sit at the lower end, may be enough to compromise follicle function without triggering any other obvious symptoms. That's what makes this deficiency so insidious. It's not dramatic. It doesn't announce itself. It just quietly shifts the balance of how many follicles successfully restart their growth cycles after each shed. And over months and years, that shift becomes visible as thinning. The clinical data makes this connection harder to dismiss with each passing year. In 2020, a case control study published in the International Journal of Dermatology by Sankey and colleagues examined 50 men with androgenetic alopecia and 50 healthy age-matched controls. The mean serum vitamin D level in the hair loss group was 2010 nangang ml. In the control group, It was 29.34 ml. The difference was statistically significant, p less than 0.001. A 2021 review published in the Journal of Cosmetic Dermatology by Saini and colleagues synthesized the existing evidence and found a consistent inverse relationship between serum vitamin D levels and multiple forms of non-scarring hair loss, including telogen effluvium, androgenetic alopecia, and alopecia areata. The lower the vitamin D, the more likely the hair loss. Across study after study, the pattern held. And then in 2024, the most comprehensive analysis yet, the systematic review and meta-analysis published in Frontiers in Nutrition by Yongpisarn and colleagues at Mahidol University, pooled data across all available studies and confirmed patients with every major form of alopecia were significantly more likely to have vitamin D deficiency than healthy controls. In the androgenetic alopecia group alone, nearly half of all patients were deficient. The honest caveat the research consistently raises: correlation is not causation. These studies show that low vitamin D is more common in people with hair loss. They don't definitively prove that correcting the deficiency reverses the hair loss. That's a harder question to study, and the evidence there is more limited. But consider the logic for a moment. If vitamin D receptors are essential for the follicle's ability to restart its growth cycle after shedding, and that is established in the mechanistic research, and if deficiency is found in over half of people with the most common forms of hair loss, then the possibility that suboptimal vitamin D is contributing to impaired follicle cycling in a significant number of people is not a stretch. It's a reasonable inference from two separate bodies of evidence pointing in the same direction. Now, here's the part of the conversation that almost never happens. When most people hear about vitamin D and hair, they do one of two things. They either ignore it because they've heard "take your vitamin D" so many times it's become background noise, or they go buy a generic vitamin D supplement from a grocery store shelf and take it for a few weeks, see nothing, and conclude it doesn't work. Both responses miss the critical details that determine whether any of this makes a difference. Detail 1. The form matters. Vitamin D comes in two supplemental forms, D2 and D3. D3 is the form the body produces in response to sunlight. Research consistently shows D3 is more bioavailable and more effective at raising serum levels than D2. Yet D2 remains common in prescription formulations and in many fortified foods. If your supplement or your doctor's prescription specifies D2, that's worth discussing. Detail 2. Fat is required. Vitamin D is fat-soluble. Taking it on an empty stomach or without dietary fat significantly reduces absorption. This is not a minor consideration. Studies have shown that taking vitamin D with a meal containing fat can increase absorption by 32% or more. If you've been taking your supplement first thing in the morning before breakfast, you may be absorbing a fraction of the dose. Detail 3. The baseline matters more than the supplement. Taking vitamin D when you're already sufficient does very little for hair. The potential benefit is specifically in people who are deficient or insufficient. And to know which group you're in, you need a blood test. A 25-hydroxyvitamin D test is the standard measure. And crucially, the reference range on most lab panels marks normal at 20 ng/ml, a threshold designed primarily around bone health. Several researchers in the hair loss field have suggested that the relevant threshold for follicle function may be higher, potentially 30 to 40 ml or above. That difference can mean someone tests as normal on a standard panel while their follicles are still operating in a functionally suboptimal environment. Detail 4. Sun exposure remains the most efficient production mechanism. 15 to 20 minutes of direct midday sun exposure on bare skin several times per week triggers meaningful vitamin D synthesis for most people. For adults over 50, particularly those who spend most of their time indoors, use sunscreen consistently or live in northern latitudes where UV angle limits synthesis for months at a time, this natural production mechanism may be producing far less than assumed. The practical question then is, what does an intelligent approach to this actually look like? Step 1 is getting tested before spending money on supplements. Ask your doctor for a 25-hydroxyvitamin D test. Request the actual number. not just a normal or abnormal result. If the number is below 30 ng/ml, you're in the insufficiency range. If it's below 20, you're in deficiency. Both may be relevant to follicle function based on the research. Step 2, if supplementation is indicated, is choosing vitamin D3, not D2, and taking it with the largest fat-containing meal of the day. A dose of 1,000 to 2,000 IU daily is a commonly recommended range for maintenance in people who are insufficient. Higher doses may be appropriate for deficiency, but should be guided by a healthcare provider, as vitamin D toxicity, though uncommon, is a real risk at very high doses sustained over time. Step 3 is not expecting a fast result. If vitamin D deficiency has been impairing follicle cycling for months or years, restoring adequate levels doesn't produce immediate regrowth. The follicle cycle operates on a timeline of 3 to 6 months. Any improvement in the proportion of follicles successfully restarting their growth phase after shedding will only become visible gradually, as new growth at the roots over that multi-month window. Anyone checking their hair at 4 weeks and concluding it hasn't worked is measuring at the wrong time. Step 4, and this is the one that matters most, is not treating vitamin D as the sole answer. Hair loss after 50 is almost never caused by one thing. The research on vitamin D doesn't exist in isolation. It sits alongside evidence on iron, zinc, B12, copper, DHT sensitivity, scalp circulation, and other factors that can all contribute simultaneously. Correcting a vitamin D deficiency while ignoring other contributors won't produce the full picture. Here is what the research on vitamin D and hair actually says, honestly, without the hype. It says that vitamin D receptors are essential for normal hair cycling in ways that have been clearly demonstrated in molecular research. It says that deficiency is found in the majority of people with the most common forms of hair loss. It says that the connection is consistent enough across enough studies that it warrants routine evaluation. Not as a cure, but as a missing piece of information that a simple blood test can resolve. And it says that over half of American adults between 50 and 79 are already deficient or insufficient. If your dermatologist or primary care doctor hasn't brought this up in the context of your hair, that's not negligence. It's the gap between what research publishes and what clinical practice integrates. Closing that gap is something you can do in 10 minutes at your next appointment by asking for the test. That's the kind of conversation this channel is built to start. Drop a comment below. Have you had your vitamin D levels tested recently? Did the number surprise you? Those responses help drive the next videos in this series. Everything shared here is for educational purposes only and does not replace individualized medical care. If you're considering vitamin D supplementation, especially at higher doses or alongside medications, talk to your doctor first. See you in the next one.